Alright, so I checked the patient's charts and it says that I need to deliver oxygen, so I'm going to knock on the door. Hi, Mr. Smith. My name is Amy and I'm a respiratory care student. Today we have an order to give you an oxygen tank today. So here we have an oxygen tank, and the way you can tell that it's an oxygen tank, it is green color. And also on the side of the tank, it always tells what kind of tank it is. And this is an oxygen, so it says oxygen on the side. Now I'm just gonna, before I give this to you, I'm just gonna make sure I have the correct ID band here. So I'm gonna check the name and date of birth, and then I'm gonna assess the patient. I'm always gonna make sure my hands are clean before I touch a patient. So I'm gonna check their vital signs before I apply the oxygen. So here with the oxygen tank, you never want to have anybody smoking around it, anybody playing around it, because if this gets covered or if any heat gets around it, it can combust and then it can cause a really bad fire. Now I have set outside the door, I have put no smoking sign out on the door frame. That way any patients or any visitors that come to see you or visit you, they know that they cannot smoke in the room around you, okay? So when you have this over here, you always need to set it off to the side, away from anybody. Don't let any children mess with anything with the tank, because it can really mess up with your oxygen. So before I begin, I always need to crack the cylinder, so you're gonna hear a little loud noise. So I crack the cylinder, then I grab the proper regulator. So I have a pin index safety system here, and it has a washer, and I always need to check that to make sure it has no cracks or anything, and it doesn't need to be changed before I apply it. And then I also need to check the pins to make sure that it's a proper regulator to go to the oxygen tank. So I have the 2 pins here. So when I'm ready, I'll apply this to here, and I would tighten it up. Make sure it's completely tight, and I always, before I turn it on, I always need to make sure the regulator is at 0. So since it's at 0, I can turn on open the tank up, and then I can see that it shows 1,000 there. And so this is an E-cylinder, so I take 1,000 times 0.28 divided by the flow. And today the doctor prescribed you to be at 2 liters per minute. So with the 2 liters per minute, I always need to check before I apply a device like a nasal cannula or something like that. I always need to check to make sure there's a good flow. And once I am done and I'm done using the tank, I always need to shut this back off to 0 and turn the tank off before I remove the regulator. So after I have the tank off, I always need to turn the regulator back on to empty it to 0. Once it's to 0, I can turn it back to 0 and remove it from the tank. And if you have a cap, you can put a safety cap over this if you have one. And then I would place this in a safe place. Now, Mr. Smith, when you have the regulator on, if it gets down to 500, make sure you let us know so that way we can change out the tank. So whenever I put on oxygen, I always need to come back and reassess the patient. So I would go back and check their vital signs to make sure they are doing okay on that liter flow and they're getting the proper amount of oxygen. So when I am always done with giving patient a treatment, I always need to chart it in the charts and let any nurse know that they are on oxygen, especially an oxygen tank, to always check it to make sure it's full.